Calcium-silicate bioactive cements are used to repair the dental pulp, but present clinical drawbacks, including prolonged setting time, limited radiopacity, and variable mechanical and handling properties. The cements are sold in capsules containing a mix of powders and pre-dosed liquid. Unfortunately, this one-size-fits-all strategy disregards patients' specific needs or clinicians' preferences. Alternatively, the powder can be hand-mixed with a quantity of liquid either suggested by the manufacturer or defined by the clinician. But this strategy can induce variation in the properties. It is virtually impossible to optimize several cement properties simultaneously by adjusting single inputs because they interact and induce trade-offs in properties. For instance, higher liquid content increases flowability but decreases mechanical properties. Herein, we have used Taguchi's methods and genetic algorithms to produce cements with predicted properties. We found that inputs induce significant trade-offs in properties. For instance, high diametral strength can only be achieved by lowering the pH and radiopacity. Likewise, making the cement more fluid will decrease the radiopacity and diametral strength but increase the pH and setting time. Our data suggest that achieving the shortest setting time, peak radiopacity, highest diametral strength, and pH is not possible. Notably, we tested 4 cements produced using the recipes suggested by the algorithms, and the properties tested in real life matched the values predicted by the computer. Finally, the cements designed by genetic algorithms were bioactive as they increased dental pulp stem cells' alkaline phosphatase activity and mineralization potential. Our work shows that genetic algorithms can be used to produce bioactive cements with on-demand properties. Hence, manufacturers and clinicians can know how the setting time, mechanical performance, radiopacity, and alkalinity potential will be affected before adjusting cement composition and liquid content.